Recording. Give a second for that to start. Alrighty, then we are ready to roll. So thank you for yet again attending another afternoon webinar. I'm going to take you through some of our thoughts and best practice that we have figured out so far as home visits. And I see this as kind of the beginning of our discussion and figuring out what this is all about. And if it's helpful, when it's helpful, when it's not, and what's going to be best practice for our kind of work. There are many different kinds of service providers that deliver those services within the home, and they do it in lots of different ways, and so that's great. We can draw on them, we can use them as role models, we can take a look at their best practice, but I know that there's going to be ways that we have to adapt it because we have a very unique kind of client base and we have a very unique function working with those clients. So first of all, when I'm saying home visit, what on earth am I talking about? Well, ultimately, it's simply providing services to a client in her home, with the idea that maybe home might be her home. It might be that she is at the moment staying with family or friends, so it may not actually be, quote, her home. It may not be, it might be the hotel room that you've put her up in for the evening or for the week. There's lots of places that, in this case, kind of count as her home, where she's living currently. And what those services would look like, it could really be just about anything that you typically provide. Certainly safety planning. There may be forms for income maintenance that she has to fill out, or promised jobs, or housing, or some kind of back-to-school scholarship program or whatever, assistance with that. Certainly some one-on-one counseling or group counseling with the family. I'm particularly thinking of parent-child relationship building and restoring. Individual financial assistance in terms of the Allstate curriculum if you want to get really formal, or simply, here's how you work out a budget, doing it in a more informal way. So all of those things would be quite deliverable within somebody's home environment. So why are we bringing this up? And the answer is because at this point, if we're completely re-envisioning our work, we want to put everything on the table to start with. We know a couple things from the get-go. We know that we have not been in the past able to reach all of the clients that are out there, and there are certain particular populations that we have largely overlooked or been unable to reach for one reason or another. And so we want to make sure that we have ways of getting to them that overcomes whatever barriers we've had in the past. One of the things that has happened with regionalization is that it does increase the distance between service providers, or at least between the home organization, or the term that I've kind of latched onto is the mothership, between the mothership and the client. That, before maybe you only had to worry about the county you were based in and maybe the next counties around, and now you might have to be going 2 or even sometimes 3 counties over. So how do we deal with decreasing that distance and making ourselves accessible? Another thing is, I do think that we are smarter. We know more about what our clients need. We know more about the best ways to meet those needs. We know more about the risks, and we are a whole lot more connected to other systems than we have been ever before. Now when you say domestic abuse advocate, maybe the person on the street doesn't know, but I'm guessing all of the systems people within your community, law enforcement officers know, the medical personnel know, certainly the court personnel, all of those folks know exactly who and what you are and what you're talking about, and in the past that wasn't true. So we have evolved, essentially. So let's put everything on the table and figure out what we want our new models to look like. What I would say is that we don't, ICADVA, if I'm going to speak for ICADVA, we don't, and Iowa CASA doesn't, so I'll go even more out on a limb and I'll speak for that agency. And Crime Victim Assistance does not have a requirement that all programs will now be doing home visits. But what I want is to just put the idea that it is on the table, that there are going to be clients for whom this is actually the most appropriate way to do it. And before, we pretty much had a standard philosophy of it was unthinkable, period. We're not going to go there. We're not going to talk about it. Boom. So let's talk about it. Let's have some of those conversations. How are we going to make it work if we want to incorporate it, and when would we want to incorporate it as far as which clients? So what are the strengths of home visits? Certainly you're talking about removing transportation barriers for people who simply don't have cars, or there's no bus pass out there in that buses in that rural county, or they don't have a bus pass, or they are housebound for some other reason. Maybe they have a disability that makes it very difficult for them to get out and physically go to wherever services are located. They may have childcare issues. They may have no internet access, you name it. So that's certainly one of the key strengths that thinking about home visits can address. A lot of different agencies, and I'm thinking of FADS, which is Family Development and Self-Sufficiency is what that stands for, workers. Lots of the stuff that's directed towards Child Protective Services workers. All of it talks about doing in-home stuff as a way of kind of forcing their work to be more strength-based about the family and to be more engaging with the family than having that family. In other words, you're on their territory, right? You are on their turf. You are in their world, and so it is much easier to focus on what do they value, what is important to them, what are their priorities, than having them come and sit in your world where they may be less likely to speak up, they may feel more intimidated, more uncomfortable, and of course you've already utilized a lot of their resources, both physical, financial, and emotional, just simply to come and be in your office. So they talk about how this is often a much more strength-based approach. We know that one of the key factors for survivors of domestic abuse to be able to remove barriers is reducing isolation, that is something the batter specifically targets to cut her off from emotional and social support, and this is one of the things that home visits can directly address. So it can, again, you are helping to take something to her and to take it to her in person instead of just over a phone. You are able to, you're more able to make sure that she actually makes her appointments. In other words, given all the other barriers, coming in to meet with you may fall off to the very bottom as far as where she's going to put her priorities, even if it might be critical later down on the road. You know how it is. I'm going to only do what I can deal with today, and today the one thing I've got to do is this, and meeting with my advocate, forget it. So it is a way of giving that extra boost to make sure that those meetings happen. Okay, we'll bring it to you. And that helps to reduce isolation and to maintain the continuity of that service to that person. Kind of as a side benefit, if at the moment you feel frustrated because you set up appointments to meet with people and you have no idea if they're going to show up or not, and you might be sitting there and wondering, do I wait, do whatever? Actually, doing home visits gives you more control over your own schedule as a side benefit, because you're taking much more of an active role in making sure that meeting happens. So you are more likely to know when she's doing well. You're more likely to get positive feedback. You're more likely to know when she's not doing well. For example, when the batterer may have been making contact with her or moved back into the home even. So that's kind of, in some ways, an aside benefit for you. And certainly, home visits can provide ways to link that client to agencies. Again, with the other things, if they don't have access, if you're not focused on their priorities and kind of taking a strength-based approach, then this last piece is less likely to happen, linking to what agency she needs, making sure that it's all well and good to say, hey, we need to figure out how to get you a better job, or we need to get you, filling out these forms for X, Y, or Z. But if she has no way to get to them, that's not going to happen. So is there any way that we can, and this is also a technology issue as you're thinking about, okay, if we incorporate home visits, what kind of technology do we have to incorporate? Is there any way that we can take internet to her? Obviously, partly that's going to be about, is she in a rural area that has no towers? Where can we connect? But it may just be she needs us to sit down with our laptop or our iPad or whatever that can connect. Maybe you have to carry your own mobile hotspot, or maybe she is close enough you can get that if she just had access to a laptop and you can sit down together and fill out those internet forms. Or maybe you can sit there with your PDF form in your laptop and help her fill that out, and when you get to a hotspot, send it off for her. Okay, so those are the strengths, if you will, about home visits. So that's the good. And if you saw it, as it quickly flashed by, my title for this was Home Visits, the Good, the Bad, and the Ugly. So that at least is the good part. But let's talk about what some of the bad and ugly parts or potentials are for doing our work in this way. So concerns, very real concerns that folks have. First and foremost, what we're always about, safety of the client. So will the batterer know that you are visiting with that person? And of course, if the batterer knows, will the batterer retaliate? Will the neighbors see you going to that door, and will they be busybodies and tell the batterer? Or at least just because they see you, if they know who you are or why you're there, is that violating the client's confidentiality? Does that tell them the client's business simply because of who and what you are? When I said it could be, quote, her home, but it could be somebody else's home where she's living, does that mean that you're going to be meeting at her best friend's house and her friend is there, or their friend's children are there, and there are other people who could overhear? Are there other people who it would be hard to separate them so that they're not in the client's business? That might be an issue. Another issue is this might make it harder to escape children. How do you keep the kids busy while you're having a grown-up conversation with mom that children really shouldn't overhear? If she's coming separately to an office, you know that she's had to find childcare somewhere. That means she can only come to see you if she has childcare. This way, she doesn't need to find childcare, but there's children present. Another issue around safety, of course, is about your own. Will the batterer learn who you are as an intervener and retaliate against you, or show up unexpectedly there at the home? So that's certainly a risk. And how do you navigate that? Do we need to talk about de-escalation skills? Where are this gets into the ethical dilemmas. Where, at what point do you call the police? When you feel unsafe, or you feel like the situation is such that the client is unsafe and needs you to call the police? What if, we also have kind of this, what you don't know won't hurt you. So what if by being in the home, you suddenly now are seeing things like child abuse, or there's drugs out on the table, or there's dangerous conditions. There's holes in the floor where the children are playing. There's other illegal activity. What does that do as far as our ethical concerns and questions around things like child abuse reports? We already have that anyway, and this kind of extends those concerns into a new realm, and we'll have to figure out how to navigate that. Increased risk of boundary violations is just, and I said that systems people know who we are, but the person on the street doesn't necessarily, and our clients don't necessarily know where the limits of our relationships are. And if you come and you sit on the other side of a desk from me, that kind of physical space emphasizes the fact that our relationship is professional, it isn't personal. If I'm coming to your home and I'm sitting down and we're having lemonade together and going over stuff, it brings it more into the possibility of that seeming like a friendship relationship. And so we're going to have to work harder on keeping those boundaries very, very clear. So those are certainly some of the bad and ugly potentials about doing home visits. I think we do have to keep the whole thing in perspective as we move slowly forward in exploring it, because we do need a realistic assessment of danger. And I mean that in two ways. One is that in some ways we are more realistic than other agencies and systems that send workers into homes. I think if you really heard or thought about, the college student intern that's working with such and such program and is going in without ever having 10 minutes on domestic abuse or risk signs or anything else, and is going into people's houses and doing work, that would scare you. It scares me. And I think, okay, that program and those folks do not have a realistic assessment of danger and the possibilities. However, on the other side, because we work so much with often the highest level of danger of clients, I think sometimes we become hyper-aware, and we have our own secondary trauma issues where we are hyper-vigilant. And I think somewhere in there's a mid-range where we can say that actually the home is the most frequently used place for providing early intervention supports and services for children across the board, across every system. They do it in the home. Most of us, I certainly have been in homes of neighbors, family, friends, where there was ongoing violence, where there was ongoing battering, and I've been in that home as a neighbor, a family, or friend. Maybe the battering was happening and I did know about it, or maybe it was happening and I didn't know about it. We have a head start by already being aware of the situation and by having a safety protocol in place. That right there sets us, I think, miles ahead in our assessment of danger than most of these other providers. Okay, so I mentioned maybe some clients, but by no means all clients are appropriate for home visits. So who would I kind of want to pull out and say these are probably likely to be the most appropriate? And there's some that seem to me pretty easy off the top. Homicide survivors. So you're working with a family, the daughter was killed by the batterer. I think that would likely be, and I still think you need to do a risk assessment, but I think that is very likely to be a situation where it would be safe to visit that family in their home. Sexual abuse clients. You're working with a family and the 10-year-old was sexually abused at camp over this last summer. Again, very, very appropriate to do services in the home for that family. If you know that the batterer is incarcerated, whether that's in the county jail right now or actually in prison, it's probably going to be a much safer situation as far as home visits. Or clients who are living separate from the abuser, where the abuser is, they haven't like just left last night, something like that, where it seems like, yeah, this is a fairly stable situation for them at this point. The abuser doesn't know where they are, or the abuser has found another victim, or whatever. Those would be likely candidates. And I think that since this is a completely new sphere for us, it's reasonable for us to start conservatively and figure some of these things out, and then work closer towards ones where maybe the risk is a little bit higher, but we feel comfortable enough with our experience and the safety protocols we have in place to go another step. If the person is living with their they move to the batterer is in Colorado, they move to Iowa, and they're staying here with family, I think that would be, yes, maybe they just left the batterer. I still think that would probably be a really good candidate for looking at home visits. I've pulled some of the risk assessments that are used for other in-home providers and what they kind of categorize as this is a low risk, this is a medium, this is high, and this is straight from what other folks use, and we can decide if it fits for us as well. Animals in the home. So if there's a vicious dog, is that dog, can it be kenneled, can it be put outside, what's going to happen to the dog while you're there? I think that's a real concern. Public health concern is things like head lice, bed bugs, infectious diseases, you name it. That might be an issue for your physical health as a worker there. So are there universal precautions that need to be put in place that would make that a workable visit? If the batterer is not currently involved, low risk. Family history of suicide or homicide. Again, if you're visiting mom and her daughter was killed 2 weeks ago by the batterer, that's a pretty low risk situation. Batterer incarcerated. Moderate, they talk about things like active drug or gang activity in the family or neighborhood, and I'm going to go through some of the things that are suggested for when you arrive, what do you look for, where do you park your car. That's all about dealing with actually getting to the home, and so that's getting at some of those issues. Is it a safe place to be? Are there times when it's not a safe place to be in that neighborhood? Moderate if there's recent restraining orders or separation. We all know that that is a time when the danger peaks, so we would want to take a real good, cautious look at that and say, what was the response to the restraining order? Is the batterer honoring that or not? How recent was that separation? How much contact is that batterer still trying to have? Is the batterer currently stalking? That all needs to be examined, I think, very carefully. And a sex offender there in the home is listed as moderate, and I don't know that I have a whole lot more to say about that. Moderate, probably not high risk, because as an outside person, you're like, and this is actually true for dealing directly with a batterer too, as an outside person, those perpetrators are often heavily invested in maintaining a positive public face and portraying their victim as being crazy, as being a liar, as being as exaggerated. They're hysterical, and so the public face that they present to the courts and to workers and to the police and everybody else is typically very, very positive, even passive and charming. They're much more likely to try and charm you if you come in contact with them than to be aggressive with you. So high risk then, weapons in the home. Escalating behavior, if you've gone through some kind of a risk assessment with this client and they're like, whoo, on the far end there's been an increase in the quality or the frequency of the assaults, there's intense stalking going on right now, etc., that's probably not the best home visit site. If you have a perpetrator who doesn't try and create that good public face, who has a history of assaulting outside the family, who has assaulted police officers, etc., that's probably not the best place for a home visit. When they have actively made threats to workers before, when they showed up in court and they were drunk and belligerent and yelled at the judge, probably not the best site for a home visit. Excuse me, I take a drink. Okay, so again, pulling from other folks' best practice, what seems to apply to us very specifically. First of all, preparing before you even go and doing a risk assessment, figuring out all of those things we just talked about. Making sure that other people are aware of your plans. So there's another person on your staff that knows what time you're visiting, where you're visiting, what time you expect to be done. Making sure that you have a code word with not only the client, but also one with your fellow staff. One that would say, so you could have it so that if you call your coworker and say ice cream, they know, okay, here's where the person's at and I need to send the police immediately. You could even have it where your coworker calls you at some, halfway in or 20 minutes into the visit, just as a standard practice to make sure that things are going well, and that would be an opportunity to give your code word if need be. But also a code word with the client so that you can call right before the visit and make sure that it's still a good time, make sure that they still want to engage in that way, and they can let you know without directly saying it out loud, hey, not a good time. Like, the batterer was supposed to be in Colorado, but guess what? This morning, batterer did actually show up on her doorstep, and so she's going to tell you ice cream, never mind, forget about it. I would also say as part of preparation, take a look at what you're wearing. Are you wearing good shoes? Are you wearing a mini skirt? So what are you specifically wearing? It might be a good idea in preparation to have some voter registration cards, or I don't know, some Avon books or something that gives you another excuse for being at the home. So if you were to go up and knock on the door and somebody answers and it's not the right person, you could say, well, I'm canvassing the neighborhood to make sure everybody's registered to vote. Can I leave some cards with you? And leave it at that. So that would all be part of preparation. For arrival, some suggestions: parking close to the home, but in a way that you're not blocked from departing. If you want to pull into the driveway, can you turn around so you're facing out? Or can you park so that if you're parked in the driveway, is someone going to be able to come and block the driveway with their car? So could you park on the street in such a way that they can't park both in front of and behind your car at the same time, so you would be able to go one way or the other to get out of there? When you arrive, observe the scene, survey the scene, as they tell law enforcement. Is there something fishy as far as, is the screen door broken? Is there a dog? Is the batterer's car there in the drive? Is there anything that makes you uncomfortable? Because I also believe that we should absolutely follow our guts. Leave anything that you're not going to need locked in your car, preferably in your trunk where it can't be seen. And I really see the trunks as being these little traveling offices with files, with all of the different forms you might need, and you know, a laptop, and who knows. When you're actually, when you arrive, if the person that you made arrangements to see isn't there, leave. Don't, you know, just go. When you're in the house, if you can sit in a way that you can see the exits, great. You do want them to have some, you know, part of engaging with them is allowing them to have some, this is their home, some control over where they sit you. Are they sitting you in the kitchen? Are they sitting you in the dining room? Are they sitting you in the living room? Is it just a one-room hotel room and you really are just sitting on the beds because that's the only place to sit? Great. But is there some way that you can at least have a clear view of where an exit might be? So during, you're going to, of course, use all your active, engaging listening skills. Might be nice to have crayons or something with you that you could use to distract the kids, which would be a great thing to carry around in your trunk, some kind of kids' activities. I don't know if turning off the TV is a good idea or not. That's one of those play it by ear. Is having the TV on in the other room give the kids something to do while you're talking, or is it making it so hard to have there's a TV or radio on right there that the person you're talking to cannot focus? Maybe you could ask them to turn it off while you're there for the visit. Plus, it's going to be easier for you to hear a car pulling up if there isn't, you know, a lot of background noise going on. One thing that isn't recommended during visits is that you carry a weapon. There's lots of research that shows that carrying a weapon only increases the risk to the worker, and so not a good idea to be armed when you're doing home visits. And of course, this is the client's turf, so to the extent that you can, you are respectful as being a guest within their home. Chances are, particularly if we're able to do accurate and thorough safety assessments beforehand, we don't have to worry about de-escalation because we're not actually going to be dealing with a batterer. But here's the thing, stuff happens, right? We can't make policies that will prevent and predict every single situation. Sometimes things just, the snowball just gets rolling and suddenly you're in the middle of a situation you never imagined, or one situation kind of one decision tumbled into the next, and now you're going, oh heck, what do I do now? So de-escalation, it could be that the batterer is upset with you, but honestly, de-escalation doesn't hurt to have those skills when working with clients too, because some of our clients are angry. They have every right to be angry, and sometimes we are very safe targets to be angry at. Or maybe you're there visiting and she's staying with her mom right now, and client is in one place, but something happens during the conversation and mom goes off, I told her this would happen, rah, 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 rah. So de-escalation, obviously remaining calm. Again, using your active listening skills, reflecting back people's feelings, empathizing with their frustration and their anger and why they should feel that way. Politely ending, saying, you know what, I can sense right now that this is not going to get anywhere. In the past, what I have learned is that we need to just take some time out. I've given you this information, or I've done, you've told me this other thing. I need to go back and check out some information, whatever it needs to be that you have to say, to basically say, we're going to stop here, we're going to take time out, and I'm going to leave now. Okay, and I'll get back in touch with you about when we can set up another appointment. If what you're simply doing is, I don't know, simply is the word, if what you're doing is witnessing escalation and you have two folks, daughter and mom, that are about to get into it, or batterer has unexpectedly shown up, you need to leave. You need to never put yourself in the middle of that. And please don't hesitate to call 911 during or call 911 after an incident to have them come and do a safety check on the client. I would also say if you're uncertain, it would be helpful before you begin having home visits to maybe have a conversation with the law enforcement in that area and say, this is something we're going to be doing as a change in practice with a few select safer situations, and we need to let you know that we're doing it, and we need to let you know that if we call for a safety check, yeah, we really mean it. That we want to have you be our backup as we try this new thing. Probably with the clients that we're selecting out for this, it's not going to happen, but we need to let you know that we might be calling you. That would be some interesting prep work to do. So after a visit, again, if you told people where you were going to be and when, you need to let them know that you're done, that it's safe, and debrief and say, here's what went well, here's what didn't, here's what I think we need to do next time. I think debriefing with the client, too, if you can talk on the phone, email, text, whatever, to say, how did it go? Is this working for you? When do you want us to meet in your home again next time? And making sure that you've debriefed for both yourself and the client, essentially. As far as supervising and supervision of advocates that are out doing home visits, I've talked about the need for code words. I think having a plan in place, if you say that you're going to be meeting with Sally from 2 until 3 o'clock and we have not heard from you at 3:15, then our plan kicks into place that we will be calling the police to go do a welfare check at that location. If advocate is not done talking to Sally at 3 o'clock, advocate can always call and say, hey, we're gonna talk until 4 and let you know. But that you have some kind of a backup plan for doing welfare checks. Working in pairs initially, so you can have one person who is paying attention to the surroundings, who's distracting the kids, doing that kind of environmental stuff while the other person is focused on the client. That might be a way to go about stuff. And I would also suggest job shadowing for a while with other folks in other agencies in your community and seeing how it is that they do home visits and what part of that would be a practice that you could adopt that would be useful. And then debriefing as a group. I guess I shouldn't have, I'll go back one. Debriefing as a group, so not just about an individual home visit, but at your next full monthly staff meeting to say, okay, we've been trying that. Do the practices that we have in place, are they working? Is there anything that we need to change? And doing some check-ins just as a group in general rather than just about the individual visits. Tools. Technology. So this is the if we could, we would list. If we could, we would. It would be great to have laptops and or iPads. Laptops with a mobile hotspot or an iPad, which isn't a mobile hotspot because of the need for internet access. If we could take some kind of computer and some kind of internet access to each of these visits, that would be great. If we have access to intake forms, either on the computer or in hard copy for the different service providers that you might be referring this person to. It may be that that service provider would be happy to have you sit down and work through it and fill it out with that person, or it may simply be that by taking it ahead of time and sitting down and going through when she has to go to that agency and actually fill it out for real, she'll have more confidence. She'll know what documentation she needs to bring. It'll just make it more likely that she follows through and that contact when she goes there is successful. So it could work either way, where you truly literally fill out the form or you just go through it with them to give them that extra step of confidence and clarity about what it involves. Other tools, I talked about fake brochures or voter registration cards or you name it, to have an excuse for being there, and stuff for the kids. Stuff for the kids. I touched on ethical issues before. I think the biggest one probably is around child abuse, and in that I'm including neglect issues like really, really dirty, unsafe, unsanitary homes, drugs out of easily accessible to kids, or weapons easily accessible to kids in the home, hoarding issues, things like that are probably where we're going to be making some hard decisions in regard to child abuse. And what I would say here, I'm just going to refer you back to the exact same decision tree or issues that are covered in our service standards. So in that, under child abuse reporting, it says, unfortunately, situations will arise, and these are the things that you need to consider carefully before you go through with that report. And then it says, and here's the things you will have to be reporting that are included in the report if in fact you do it. So the decision tree issues that are in there, will making a report increase the safety of all family members, or how will it impact the safety of all family members? How will it impact a child's relationship with their mother or with other family members? What is the current safety plan for that child, and could whatever your concern is simply be addressed in your safety plan? Could that be adapted to deal with whatever is going on that is causing you ethical concerns? Impact on the relationship between you as an advocate and that parent, and you as an advocate and that child. What is it that you hope to have happen if you make a report, and is it actually going to happen? Sometimes when I have talked through these with folks, what has become clear is what an advocate is hoping is that Child Protective Services has the ability to prevent an abuse from happening. In other words, something like Jenny, child Jenny is 8 years old and is scheduled to have visitation with scary, dangerous dad this weekend, and we know from past experience that there's a real likelihood that child Jenny will be at the very least physically abused and probably sexually abused during this visitation. So can we call Child Protective Services and stop that from happening? And the answer is no. That Child Protective Services cannot do anything preventatively. They can only act after harm has happened. So you really have to think through, what is my goal in making this report, and is the agency I'm talking to, do they actually have the legal authority or the resources to achieve that goal? Another part of that decision tree, does it actually meet the criteria of child abuse? There's a lot of things that you or I might think are abusive or neglectful, but if they don't meet the legal definitions of child abuse as listed out in the state of Iowa, there isn't anything DHS can do about it. So these are their categories, and has to fall within one of those categories. And by mental injury, I have to say, they mean that you have to be able to have a certified mental health practitioner, a psychiatrist, or somebody who is willing to testify that this child has experienced extreme damage to their mental functioning, and that damage is directly caused solely by this particular perpetrator. That almost never happens. I mean, not that that kind of injury doesn't happen, but the ability to have somebody that will say that and can prove it, that category is almost never used because it is so hard to substantiate. Has to be a caretaker, has to be a minor. Need to think about whether or not there's enough evidence to substantiate a report. And that doesn't mean that you have to be able to prove it in a court of law. It's kind of the 51%. It's is there enough that the evidence tips that way more than not to substantiate the report. Let's see, I've talked about some of the others. And then what are the consequences of violating confidentiality for the client? What are the consequences of violating confidentiality on your program? In other words, if other clients, and they will, learn that your program makes a habit of reporting moms or homes or, you know, for whatever, how is that going to impact the way those other clients interact with your agency and your reputation amongst your client base? Another big issue, ethical issue with home visits is confidentiality. Are there other people present? Are there other people present? Is the client comfortable having that person present? Does having that person present eliminate privilege? I am not an attorney, but my read of it is, yeah, it probably does. So if I'm sitting down talking to Jenny and she's been brought in by her best friend Lupe to live with her for a while, having Lupe present, Lupe is an outsider. She's not a crime victim. Lupe is not covered by confidentiality, and bringing that in, I think an attorney could make a very clear case that if Lupe is going to be part of that visit and part of those conversations, that that conversation has no confidentiality, no privilege. And I will leave it up to our attorneys to suss that one out in full, but I think that's a very big issue. And if we are making home visits, there's a likelihood, a greater likelihood that there would be concern to others and support people that want to be part of that. But we would have to make it very clear with our clients that if they are there, we cannot guarantee confidentiality. The issue of neighbor seeing, I think, is very real. I would also balance that against the fact that historically we have always met people in public places. And if you're talking about small town, hey, let's meet at the Hardee's or whatever, the Hy-Vee Deli, the neighbors are seeing that. And the neighbors are, so to me that's almost a wash. Which one is more or less confidential than the other, whether I'm sitting in a public place discussing this person's safety plan right next to the neighbors, or if there's a chance that the neighbors are going to see my car and wonder who's visiting at that house and maybe say something to batter. There's issues both ways. And I've already talked about the boundaries issues, that you're more likely to be seen as a friend. And I also think that you're more likely out of our, most boundary violations are not because people have bad intentions. The vast majority of boundary violations are because of our own desire to do good. They are compassionate violations. And so I think that you're more likely to be pushed outside of your comfort zone of what you know you should be doing and where you know the boundaries are. If you're doing it, shall we say, out of sight, away from the direct observation of your peers, in private, I think you feel that pressure to be nice, to be agreeable, to say yes to things. You're more likely to do that when you're working on your own, away from your peers, than you are if you're in a peer environment where you can, the fact that you will be held accountable to that decision is much more in your awareness all the time because your peers are around you. That's not just an issue for home visits. I think that's an issue for anybody who's doing outreach who might be working in a county and they're spending 90% of their time working on their own, and once a week or once a month they're connecting to their fellow advocates in the mothership. I think that's an issue as a rule that we are going to have to take a closer look at than we have in the past as we move forward with restructuring. So what kind of next steps towards taking a look at home visitation? Let's take a look at policy and develop our practices, write it on down. When would we possibly do it? Where? How would we do it? Have those conversations with law enforcement. Do ride-alongs. Find a mentor who has been doing home visits in some other system for years. Work as pairs. And maybe do those, the mentoring and ride-alongs before, or certainly as part of beginning to put together a practice within your program. And of course, I said debrief not just case by case, but overall reassess and make changes. This is a learning process. We are going to make mistakes. If we don't make mistakes, we're probably not doing it right. What I mean is that means that we're probably still doing what we've always done. Learning happens through making mistakes. So it might be when we make a mistake that the policy is an error. It might be that a policy is great, but there's absolutely no way for a policy to address every circumstance that's going to arise, because anytime you're dealing with human beings, funky things are going to happen. So part of our steps is to make mistakes and to learn from them, and to keep the conversation open not only within your program but from program to program. One of the things that I am finding interesting when I hear what one region is doing, what the other one is doing, what the other one is doing, is that for each region it seems like there's something that is coming forward that they've worked on that's a really good idea, and we need to have a forum for sharing those and seeing what can be used from region to region, kind of the gems that people are producing under this massive amount of pressure. So I guess those would be the diamonds that come from the massive amount of pressure. So my clock says it's almost 2. I don't know, are there any comments or questions that folks have? Because I think, yep, that's the end of my slides. I'm going to take a drink while you get a chance to respond. Well, as always, this was recorded, and I will make it available on our GoToWebinar. Unfortunately, GoToWebinar only stores things for a couple months on their servers, and then they disappear into the ether, even though they are permanently captured on staff computers here. So in the future, we are reorganizing our ICADVA's website, and my intention is to have a very easily accessible library of webinars where all of these things that we've been doing over the past few years are uploaded in one specific place, hosted off ICADVA servers, so we know it's permanent and easy to get to, because what we've been doing has been a little bit difficult. How can we get the webinar that Zeb did this morning? I will double check with him and make sure that he recorded it, and he should be, once we've recorded it, records to our laptop, and then we have to upload it back to GoToWebinar, and then there's a link there that's available, and we can send that link out in emails, and then anybody can click on that link and boom, they go to it and they can watch it on the GoToWebinar site off of their servers. So I will just make a little note to myself to ask him to make sure it's uploaded and send out a link. Anything else? Okay, well, thank you very, very, very much, and go off and have the rest of a good afternoon. It's kind of gotten hot out there again, so that means ice cream to me. Hopefully it means ice cream to you.